Hello CACU team, thanks for checking out this video. This video is hopefully the first of many informative videos for you, the CACU staff, to help you grow and learn whenever you have time to watch. This video is brought to you by your CACU leadership team, where we believe that sometimes the training needs to come to you so you don't always have to come to training. Today's topic, 12 lead EKG placement. So let's jump right in. All right, so let's talk about our standard EKG lead placement to acquire a 12 lead EKG. All right, there's lots of information out there that is available on the internet regarding standard EKG placement. All right, we start out with the limb leads. As you see here, I've got highlighted the 4 limb leads. All right, so standard placement would dictate that those limb leads are placed on the limbs. That's not always practical with our patient population, toddlers, infants, those children that cannot follow directions. Moving extremities equals artifact. Artifact equals not a quality EKG. So what we are going to do for our specific patient population is utilize the torso. Utilizing the torso to place our limb leads is best practice. All right, it's going to eliminate the excessive artifact and thus give us a quality picture. You guys will be familiar with this lead placement because it very much rivals, it looks exactly like our telemetry lead placement. Right arm, left leg, right leg, okay? So we're going to start out with lead placement in that situation, okay? And not use the actual limbs and cause more artifact and a poor quality EKG, okay? You'll notice here by looking at this picture that there are only 10 electrodes. All right, you may not have a lot of experience with 12 lead EKGs. You may assume that there's 12 electrodes to obtain a 12 lead EKG. That's just not so. So 10 electrodes, that is going to be our standard lead placement. So let's start out. We're going to start out by applying the 4 limb leads. All right, so let's jump on that. We will jump on the standard placement of our limb leads. You'll see here I have a torso in front of you, and we're going to use this torso to represent our lead placement. So starting out, we're going to put right arm, left arm. Notice these are different electrodes than what we use for telemetry. All right. Left leg, right leg. We'll talk a little more about connecting these in just a moment, but you see this very much looks like those, the picture that I just showed you with the torso, with the limb leads on the torso. All right. So let's talk a little bit now about the chest leads. Okay, and there's some specifics, there are some nuances that we have to be familiar with our patient population. All right, so lead placement for patients over 10 years of age. All right, so you guys will know how old your patient is. All right, you'll know that. So the lead placement for those patients, all right, it's got V1, V2, V3, V4, V5, and V6. Okay, so let's talk about that, and we're going to actually place the electrodes in place. For V1, we want to go to the 4th intercostal space to the right of the sternum, okay? For some of our patients, where a lot of our heart patients, if they're not real chunky, they don't have a lot of meat on them, intercostal spaces are really easy to palpate. For others, it may be a little more difficult, okay? But we're gonna start. We're gonna try to find those intercostal spaces. There's 1, 2, 3, and then there is 4, all right? So V1 is going to go in the 4th intercostal space, and again, we wanna use the space. We don't wanna place it over the bony prominence or the bony part of the rib, okay? So we're gonna go to the right of the sternum. V2 is real simple. we're going to go right across the street, okay? And we're going to go in that same intercostal space, and we're going to place V2. All right, I'm going to intentionally skip over V3, okay? And I'm going to go to V4. All right, V4. All right, notice this picture right here. This picture, it's got a picture of the midclavicular line. All right, and that is on purpose. We want to drop down one intercostal space. Okay, so here's 4. We're palpating it out. And here's 5. Okay, and midclavicular. All right, so I am going to place V4 in the 5th intercostal space, midclavicular. All right, and then I am going to skip over V5, and I am going to go to V6. V6, the mid-axillary line. Okay, the mid-axillary line over here. Let me slide this over, get a little bit better picture. Okay, V6, that same intercostal space, still in the 5th intercostal space, I am going to go to the mid-axillary line. Some texts will teach directly under the armpit. Other places will say towards the front part of the mid-axillary line. And then V3 and V5 are real simple. You basically fill in the blanks. All right? So fill in the blanks. All right? And guys, there you have it. There you have it. You see 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10 electrodes. Okay, 10 electrodes. So let's go through that real quick. Again, these are for patients over 10 years of age. So let's go through it real quick. We have the right arm. We have the left arm. We have the left leg. We have the right leg. We have V1. We have V2. V3, V4, V5, and I'm sorry, you can't really see it. Let me turn it. And then we have V6. All right? With those lead placement, with that proper lead placement, we can provide a good quality study for our providers to look at and review and provide some really good patient care. All right? So, what about patients that are 10 years of age and younger? 10 years of age and younger. Lead placements for patients 10 years old and under. Notice there's still that midclavicular line, okay? The limb lead placement is not going to change, okay? The limb lead placements for those patients that are 10 years of age and younger are still right arm, left leg, and right leg. But you notice one really weird thing. Look at V3. V3 is normally in between V2 and V4. For these patients under the age of 10 years old and under, we're going to put V3 in the same spot, but to the right of the sternum instead of the left of the sternum. Okay? So for that EKG picture, I would basically place that right there. All right? The connection is the same. We're just moving it across the street on the other side of the sternum. All right? So, those are our 10 leads that we've placed. Okay? We're moving V3 onto the right of the sternum for patients who are 10 years old and under. All right? For patients who are over 10 years of age, the lead placement is exactly like it were to be if you and I were to get an EKG. So it's the standard lead placement, the same as it is with adults. All right, so we have some other things I just want to bring to your attention. What about the patient that has a known diagnosis of dextrocardia? A known diagnosis of dextrocardia. So it's really simple. Their heart's on the wrong side, or they shouldn't say wrong, maybe the opposite side of the chest. So we're going to put the chest leads on the opposite side of the chest. Lead placement is exactly the same. So in those situations where your patient has a known diagnosis of dextrocardia, use this as your guide. All right? All right, so what about the clips? Okay, you'll notice here that there's this little tab, okay, this little tab. This is an example of our clips. Okay, I don't have the wires, but this is the example of the clip. Okay, this is with the clip up, that's with the clip down. Okay, so basically it goes on there. Obviously the wire would be connected, and then we just connect it, and then it is connected. Okay, and we will do that 10 times. All right, 10 times. So a little pro tip from our friends over with the arrhythmia team that do EKGs every day, Monday through Friday during the day. So they do a ton of 12 leads. All right, so a pro tip from them are, when do you place the clips on? Do you place the clips on the electrodes first and then do the EKG lead placement? Or do you do like what I've done here and done our EKG lead placement, or done the electrode placement and then place the clips? So according to those guys that do a lot of these, a pro tip from them, kids over 2, place the electrodes on like I have done. So place the electrodes all on and then come in and put your clips on. All right. For children 2 and younger, they recommend to place the clips on the electrode and then find your lead placement. Okay, so it's basically ready to go for those toddlers and those kids under 2, and those infants that are squirming and moving around. Okay, so that's just a pro tip from them. So the pictures that you've seen here, guys, all of these pictures are available on the 12-lead EKG cart that we have on the CACU. And also, we're going to email you a copy of this, the PDF, so you can review this as well. All right, so I hope this was of some help, and it's increased your knowledge and hopefully your comfort level with placing the electrodes for an EKG. More information will be coming out soon regarding the operation of the actual 12-lead machine. So be on the lookout for that. Let me know if you have any questions, if I can clarify anything for you. And again, thanks for watching, and thank you so much for what you do each and every day. See you guys soon.